Can ayahuasca cause psychosis? Have you ever wondered about the effects of ayahuasca, especially regarding mental health? Today, we are tackling a critical question. Can ayahuasca cause psychosis? Ayahuasca is a traditional hallucinogenic brew that contains dimethyltryptamine, commonly known as DMT. This powerful psychedelic primarily interacts with serotonin receptors in the brain. It is often used in ritual and therapeutic contexts, particularly in the Amazon region. When discussing psychosis, we are referring to severe mental disturbances. These can include delusions, hallucinations, and impaired reality testing. Such symptoms can have serious consequences for individuals. So, how does ayahuasca fit into this picture? The active compound in ayahuasca, DMT, is a serotonin 5-hydroxytryptamine to a receptor agonist. This is similar to other hallucinogens like lysergic, acid diethylamide, and psilocybin. In controlled settings, the use of these substances typically shows a low incidence of psychotic episodes. Psychosis as a direct result of ayahuasca is considered rare, especially when used in traditional, controlled environments. However, there are case reports and clinical observations that indicate psychotic episodes linked to ayahuasca use do occur, but they are uncommon. Most of these cases involve individuals with pre-existing risk factors. This includes a personal or family history of psychotic disorders, such as schizophrenia or bipolar disorder, or previous substance abuse. Psychotic symptoms can manifest as delusions, paranoia, hallucinations, and disorganized thinking. In some instances, these symptoms can persist beyond the immediate effects of the drug. While there have been cases of psychosis developing in individuals without prior psychiatric history, these occurrences are less frequent. The risk of psychosis can increase with uncontrolled or abusive use of ayahuasca. This is particularly true for those self-medicating for mental health issues like depression. Using ayahuasca obtained online or outside traditional settings raises the likelihood of adverse psychiatric reactions. Individuals with a history of psychosis, mania, or severe mental illness are advised to avoid ayahuasca due to the potential for triggering or worsening symptoms. To manage these risks, psychiatric screening before ayahuasca administration in controlled settings is essential. If psychosis does occur, treatment with antipsychotic medications can be effective. Awareness and caution are necessary as ayahuasca use spreads beyond indigenous and ritual contexts into recreational and alternative therapy settings. Monitoring the environment and psychological state of users is important to minimize risks. In summary, while ayahuasca can cause psychosis, such cases are relatively rare and often involve individuals with underlying vulnerabilities or those who misuse the substance. Controlled use tends to have a low incidence of psychotic reactions. Understanding the potential for psychosis highlights the importance of careful screening, responsible use, and medical supervision to prevent severe psychiatric outcomes.